May I request Daniel to come up and start this presentation?
Hi, welcome. Thanks for the opportunity to talk about conflict and displacement. I want to talk to you today about the effects of conflict on displacement on our progress against improving and reducing hunger and malnutrition. There's clear evidence that conflicts have been growing over the last 10 years, getting much worse with more than 1 billion people affected. And that's also leading to substantial displacement. So in 2017, we had 68 million people displaced from their homes. It's been growing year after year. Most of those are internally displaced in their own countries, but 25 million of those have been displaced across borders. And in general, these are extended displacements. On average, those people will spend 10 years displaced from their homes. So our consensus humanitarian response is to establish IDP camps or refugee camps to provide basic security. That's essential. That's really what motivates the creation of camps, and deliver basic services. And then, of course, we provide either cash or food transfers to those households to meet their basic needs. The problem that's been developing and increasing is that as these crises become more protracted, the model of giving food, shelter, and basic healthcare services to a sedentary displaced population is being challenged, and it's not clear that this is the best model going forward, certainly for long extended stays. Over the last few years, we've had some growing evidence about what might constitute a more effective response. So I'm sort of going to start with the answer, and then I'm going to show you a little bit of the evidence and talk about a particular study that we did a few years back in northern Uganda. So what we've learned from some recent research is that we should prioritize cash transfers when possible. So to an entirely isolated population that are forced to reside only in a camp, food transfers are going to be essential. There's no markets for access to food. But otherwise, if people have access to markets, lots of evidence now suggests that cash is going to be more flexible and does a better job of transitioning from kind of humanitarian needs to development needs. Next, we should rethink placing displaced populations in camps or making their camp residence period as short as possible. And that's linked to the next issue, which is that the camp residency really tends to cut people off from their livelihoods. And there's good information that a lot of people that are displaced, a lot of refugees, are actually near urban centers and could access employment, and yet they're often prevented from doing so. We need more examples like the Ugandan policy, where they actually provide land, access to land to displaced populations. A challenge of applying these approaches is that as you start to improve conditions for people that are receiving assistance, you actually may draw additional migration. We've seen examples of this over the last few years. It's a challenge, but not an excuse for not doing better. So in this talk, with my time, I'd just like to give a bit of an overview of the evidence on the effects of conflict and displacement on nutrition and other outcomes, and then provide a few lessons for going forward. Okay, so it's no surprise that conflict is not good for human well-being and also terrible for nutrition. But in fact, it's been very hard to measure the effects of conflict directly on nutrition outcomes. So there's several good examples I cite here of recent research. In fact, the effects on nutrition specifically tend to vary quite a bit based on severity and exposure to the conflict. The effects of displacement on nutrition are actually much more mixed because humanitarian response can be effective. And so we really see kind of a blend of results there. I cite some evidence of Syrian refugees living in Jordan, Lebanon, and Iraq, who actually, there were no negative effects of the displacement on child nutrition because of an effective response. The problem is that we need a lot more evidence in this area, and that a lot of the focus among researchers has been on the effects of refugees on host populations, and we need to, that's important as well, but we need to put more emphasis on the effects on displaced populations. In terms of the humanitarian response, there's a systematic review completed recently of the effects of cash transfers in humanitarian settings. Found just 5 rigorous studies out of 4,000 studies screened. So it's hard to do this kind of work in these settings. But found that generally cash transfers has positive effects on food security, consumption, and assets. The effects on nutrition, again, are rather mixed depending on the quality of the humanitarian response. But we have I cite a couple of IFPRI studies here, one from northern Uganda showing beneficial effects of food and school feeding on anemia prevalence for adolescent girls, and another study in Mali showing positive effects of food aid after conflict there. In general, we can apply some of the lessons that we've learned from the really substantial literature on social protection and its benefits for nutrition. Even though these are from poor and non-emergency settings, they're relevant for, some of these lessons will be relevant for post-conflict and conflict areas. That includes that cash transfers plus high-quality behavior change communication on nutrition can really move the needle on stunting, and that sanitation and hygiene remain limiting factors in improving nutritional status. Okay, now I want to spend a few minutes just giving an overview of a study that we did in northern Uganda, looking at the effect of living in an IDP camp on outcomes for children in the camp, specifically on nutrition outcomes and on education. So here we're directly measuring through data that we collected in the camps, what's the effect of being in a camp on those childhood outcomes. The context is around 2005 in northern Uganda during the LRA insurgency when 1.7 million people were displaced from their homes. This was the third largest displaced population at the time globally. The humanitarian response is one we would recognize from this area, right? So World Food Program and the government and partners, the government formed IDP camps to protect the population. World Food Program and partners provided food rations and basic sanitation. The ration levels were not enough to meet 100% of daily food needs, under the idea that camp residents might get other sources of income, either through transfers or maybe accessing land, although in fact, in reality, they could not access their land at all. So in the areas that we worked, households received either a 75% ration or a 50% ration. And generally, the sanitation situation in the camps was quite poor. So here's a picture of one of the IDP camps that we worked in. You can see that it's quite crowded. These were fenced off areas, and people were allowed to leave the camp during the day. But most of these people were too far from their land to effectively be able to actually earn a living off their land as they had been doing prior to displacement. So we used data that we collected in the camps to study the effects of actually living in a camp on education and nutrition outcomes for children that were camp residents. We did this using a regression discontinuity method that just compared outcomes for children whose families had to make important investments in their decisions about education and nutrition while they were camp residents to other children in the data where those decisions were made before the child moved into a camp. So here we see some results for the education outcomes. In general, education improved as a result of living in a camp. So the on-time starts of schooling improved by 13 percentage points, and the average age of starting schooling actually dropped, so making students actually start more close to on time. That's the evidence that you see here. So the students on the children on the left here are those that turned age 6 while living in an IDP camp, which is the age of starting schooling in Uganda. Those on the right turned age 6 before they moved to an IDP camp. So being in a camp helps children get to school sooner. It makes sense. They had less to do, less responsibilities, and the schools were very close. The story for nutrition is much worse. So for nutrition, we found that for children under age 3, living in an IDP camp increased stunting prevalence by 18 percentage points. Here, this graph shows we're comparing children who spent the first 3 years of their life living in an IDP camp to other children in the data who spent the first 3 years of their life in the same setting, but before they moved to an IDP camp. And using these methods, we get a pretty clear picture here of a really negative nutrition situation. As I said, stunting went up 18 percentage points. Average height for HC scores fell by almost 0.5 standard deviations. So this is clear evidence of a really dire nutrition situation in the camps. So what lessons do we have? I want to highlight a few. So first, we should improve the diagnostics and nutrition monitoring in camps. That comes directly out of the Uganda data. It was difficult to essentially scale the level of ration in this setting, but it's convincing that more could have been done to sort of monitor the situation and try to improve what became a pretty terrible situation for nutrition. Even short displacements and bad conditions worsen child nutrition, and that has lasting effects. And so the shorter that we can make those displacements and the shorter we can make camp residents, the better. We should really explore faster transitions from camps and integration of people that are camp residents into local economies. and there's increasing movements on improving self-reliance for refugees and displaced populations. I think we need to really accelerate that work. Also from our evidence in Uganda, the period of transition from living in a camp back to kind of routine life is a period of extreme nutrition vulnerability. And so we need to improve the way that that's managed and the resources that households get as they start to, in Uganda, begin farming again. And last, I'll just make a plug to try to test more integrated solutions. We should be doing a lot more on mental health for displaced populations. And there's growing interest and evidence and pushing on this, but I think we could do a lot more. And we should also be trying to better harness new technologies like mobile phones to be able to provide cash transfers and savings instruments and the like. Okay, thank you.